Hello everyone, my name is Shahin Nazir Mohammed. I'm going to give an overview of this poster presentation titled Nephrology Integrating Healthcare Education for Chronic Kidney Disease or CKD, topic tagging and what is deemed as clinically relevant context. And this is a paper that's from highlighting context in the format of a poster presentation, which I am honored to be able to provide perspective at Kidney Week 2021 at the American Society of Nephrology that is being held in San Diego, and this work is coming from a qualitative context or perspective, and is also a response really to work by Van Dam and colleagues in 2017, where they published works around detecting clinically related detecting clinically related content in online patient posts. And this work is also truly collaborative, where myself from the University of Western England and colleagues in University of West of Scotland in Scotland in the UK, and colleagues based in also in Washington, USA, and between research interns who are doing their internships under the Renal Patient Support Group, and work from that side is truly collaborative between the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group for Kids, or KDAS for Kids, wherein there is a collaborator from representing that organization, that's KDAR for Kids, and from where research interns are under the RPSG, or the Renal Patient Support Group, are truly doing their best through their final year research projects under Coventry University in England, UK. So I'm going to begin with highlighting really this work through a kind of an audio summary, really. The full paper has actually been published in the Journal of Clinical and Biomedical Research, and this was this was published in in the beginning of June 2021, and this is again published in the Journal of Clinical and Biomedical Research, and the way I'm going to summarize this is, or highlight this, is reading out the abstract, and then placing a little bit of emphasis in different parts, so that listeners can get a real, hopefully, an overview of this work. So to begin with, a bit of introduction and background, or background and introduction. Education and information seeking is pinnacle or pivotal for patients with long-term conditions. Long-term conditions, for example, chronic kidney disease or CKD, so that they can take ownership of health and disease, and ultimately to navigate healthcare between different sectors. In the UK, the health sectors are referred to as primary care and secondary care in the main, and this work also highlights from a perspective about how important it is to have patient and public involvement and PPI to help understand gaps in service or healthcare service in this context, or with this in relating to this work, to understand gaps in health information or education or inefficiencies. So the aims and objectives are threefold, really. Number one, involving patients between the two social media platforms to help understand which topics and subjects are pertinent to patients going through chronic kidney disease or CKD. Number two, involving patients to understand whether retrospectively there has been an educational neglect in healthcare. And number three, to understand really how healthcare and education for CKD patients could be integrated, and by way of the care pathway that they go through as part and parcel of the chronic kidney disease stage and severity that they are aligned with. To now place a little bit of emphasis on the a bit more on the background as well, in relating to the literature as well. There has been an understanding to some extent about what chronic kidney disease is. CKD is regarded as a public health problem in some way or another, we know from the literature that CKD affects 10 to 16% of the general adult population in fast and slow developing countries, and that's been highlighted in work by Chadban in 2003, Koresh in 2000, and colleagues in 2007, and Halan and colleague and team in 2006 as well. From the perspective of the UK, 5% of the UK population suffer from CKD stages 3 through 5, and that again has been highlighted by colleagues and his team in 2003. Though there's more literature. There's been literature published more recently, providing more recent statistics. There is also the work by the Renal Association, the Renal Registry, which is part of the Renal Association. The Renal Registry has published its most recent report. It's the 18th annual report, which was published earlier this year in 2021, and that highlights various chapters on different perspectives around the epidemiology and statistics around different areas of CKD and the most up-to-date data from the registry from a UK perspective. The characterization of CKD at all stages is an important part of management, and allows actually the initiation of appropriate treatments to be prompted with the aim to slow the progression of actual chronic kidney disease. And that's been highlighted by Laysor and Laysor in 2002. But again, there is more recent literature to highlight how different mechanisms have been put in place to actually preclude and prevent the progression of kidney disease. CKD in children and adults is characterized by kidney damage or a decrease in glomerular filtration rate, often also referred to as estimated glomerular filtration rate, or EGFR. So it's GFR or EGFR of less than 60 mils per 60 mils per minute, less than 60 mils per minute, for more than 3 months, for 3 months or more, and recommended by the Kidney Disease and Quality Outcome Initiative, or KDOQI guidelines, and that's those guidelines are mainly US focused, but look to highlight perspectives on general kidney population health between different parts of the world, but the main focus is in the US. But this context has been highlighted in work by Lam and team in 2013. Now, in regard to the focus around areas around qualitative research, and also and linking in with aspects of what's out in the literature. There has been a growing interest in qualitative research methods in healthcare, often associated wherein different allied health professionals, or AHPs, are looking to understand certain areas in healthcare. And however, the emphasis must be made on wherever there may be a potential gap or an area wherein such professionals are looking to bridge that understanding. An emphasis has to be made on linking that with evidence-based medicine, and that should be accompanied by recognition of the importance of understanding aspects around quality of life, and that has also has to be focused in line with prompting healthcare professionals of all disciplines to acknowledge the value of qualitative research methods or research methodology. The findings of qualitative research can complement quantitative studies, and that's been highlighted by several authors in this context. Barbour in 2000 is one of the main one of the main contributors to exploring areas of health where qualitative research is concerned. and offering insights and explanations relating to individual or cohort experiences, attitudes, and beliefs in order to inform and develop better healthcare strategies. And that's and retrospectively, that's been highlighted by Huston and Rowan in 1998. Now, in context with chronic kidney disease or CKD, and I'm just going to highlight a little bit of some context around that and healthcare education, highlighting some preliminary understanding from a paper that has been used to inform some of this work. In a US pilot investigation focusing on dialysis education, several modalities of engagement and interaction were implemented and disseminated to understand education and and also to evaluate that in line with care, in line with healthcare patients have been receiving, and this comes from work from by Esom and colleagues, or Esom and team in 2019, and what they did was to actually focus on trying to understand how they explore providing educational provision and making comparisons between face-to-face education and online sessions, and the ability really was to ensure the ability of the patient to understand and also to select a form of renal replacement therapy, or RRT, i.e. peritoneal dialysis or hemodialysis. That was the one of the main objectives of the education provision, so that they can choose the appropriate modality or renal replacement therapy modality, and so that they and not just choose that, but ensure that whatever they were choosing, it was going to be the right, it was going to be right for them. 3 assessment tools were utilized to compare groups, including CKD knowledge, chronic kidney disease knowledge, literacy, and quality of life. Education has been required to support CKD patients have a smarter understanding of disease and treatment options. Patients, one of the most intriguing findings of this, and this is also where there should be where the work by Van Dam and colleagues in 2017, of Van Dam and team in 2017, may have a specific perspective or view on what they deem as clinically relevant context, whereas wherein Esom and their team, it was highlighted, it had been highlighted that to at least some extent, that patients wished that they had been educated earlier, irrespective of having face-to-face or online modality, or face-to-face or online educational provision or understanding, and therefore, and in that context, what the work by Van Dam and team, wherein they highlight that it can be a challenge to determine what is clinically relevant context through online online platforms. For example, the work by ISAM involved health professionals to give that understanding, so that patients can get to grips with certain terminology, and also understand in some way or form that the literacy and the language that they were receiving is on par with clinically relevant context, and in ISAM's in Van Dam and the team who did their work, much of the work in that paper, in the work that was published there, was more relatable to coding and electronic patient records, and so there is a differentiation in the way works have been explored with regard to what is deemed as clinically relevant context, excuse me, in one way or another. And this is where providing up-to-date and accurate health information is pinnacle for patients, so that they can take ownership of areas of healthcare. Now, some context relating to CKD definitions and classifications. Now, listeners are more than welcome to check out the audio and the post summary audio summarizing a poster presentation that was presented at the International Pediatric Nephrology Association in 2016 relating to issues with CKD terminology. That paper forms a basis of the potential a requirement or need to explore 6 stages of CKD, wherein traditionally there are 5 stages of CKD, and stages 3 is split between 3A and 3B, and that paper and that work on the work that was presented there. Listeners are welcome to get a bit more of a robust understanding of that work, in line and again in context with and the context around patients receiving the appropriate educational provision around different CKD definitions and classifications. Now, in this context, I'm not going to go through the whole all of that as part of this poster presentation, and that's not what's been that's not the main focus in this work, but I do want to give some context. So some investigators describe acute renal failure, or ARF, as acute kidney injury, and acute or chronic renal failure also are terminologies that are used that have come about in literature, and in some regard are also have been replaced. So, for example, acute renal failure has been replaced with more so now with acute kidney injury, or has been replaced with acute kidney injury, or AKI as the abbreviation is, for over a decade, and acute and acute and sorry and acute renal failure has also been offset in most papers, where it's not really used to highlight highlight and differentiate different areas of kidney a kidney injury as well. And chronic renal failure or CRF has been replaced by CKD, or chronic kidney disease, or where it's stage 5 has been replaced using the terminology end-stage renal disease, or ESRD. Now, these terminologies have been used interchangeably in studies that have focused on acute renal failure, and also exploring abnormal estimated glomerular filtration rate, or EGFR, and work by Mohammed and team in 2020 highlight some context around this as well, and some studies have record patients with a reduced baseline kidney function, i.e. Estimated glomerular filtration rate of less than 45 mils per minute, 45 mils per minute. Then some of the many cases that require hemodialysis, or HD, were actually referred to as acute, when actually they should be referred to as end-stage renal disease, or ESRD, and potentially and where this can be a misnomer is actually where work or literature retrospectively refers to those on those within those stages, within who are acute or going into kidney disease, or CKD. Those patients should be referred to as potentially going through CKD stages 3 through 5, and so that's something to be aware of, and those stages CKD stages 3 to 5 can be associated with higher rates of morbidity and mortality. However, end-stage renal disease, or ESRD, on CKD stage 5 is at the severe end of the disease spectrum, and where patients require will be worked up for a form of renal replacement therapy, or RRT, until a kidney transplant is available or becomes available, and then basically with that being the case, kidney transplantation is also listeners should be aware that kidney transplantation is also a form of renal replacement therapy. the issue here is that terminology can become confusing, and there is quite a lot of overlap between these different abbreviations, and that causes can be one of the probable causes in misinformation or miseducation to patients with regard to CKD and stage and classification. So then there needs to be more needs to be done to address this and provide transparency between the different stages, and that understanding has been highlighted in work by Lam and the team in 2013. Now I'm going to highlight a little bit around the patient and public involvement aspect around this work and what took place, the ethics and the ethical ethics and how that was approached to conduct this work, and also some context around the material and methods. From a broad perspective, several topic tags were co-developed for this investigation, wherein topics or educational themes were developed between two social media platforms, i.e. the Renal Patient Support Group, the RPSG, and also KDARS for Kids, or KDARS for Kids. And this was done in between colleagues who were working in this work around in and around this work to ensure clarity is made on meeting the objectives, this was done also after those who were involved in developing this work, or this effort really, once the disclaimers were understood between the two different social media platforms, and in that regard, understanding really the remit of the social media platforms and what they're about, and prior to developing the topic tags, an extensive investigation took place over a month between March and April 2020, where the most popular terminologies were searched out by having an understanding of what terminologies have been used retrospectively in different literature, and those terminologies were searched out, and then threads linked to those terminologies were then more readily more identifiable. So this resulted in 14 different topic tags being developed. Topic tags were tagged for 2 weeks. Topics were tagged, for 2 weeks per social media platform. So 2 weeks on the RPSG and 2 weeks on KDARS. Topic tagging retrospectively helped and aided to bring about an understanding of healthcare areas that are popular and where patients between the two social media platforms benefited from where it was also identifiable really where patients using these two social media platforms or these two social media closed social media platforms could benefit or would benefit from further educational involvement. Just to highlight as well that topic tagging has been highlighted and that particular methodology has been carried out in research by Murison in 2005, Sivan and Pratt in 2007, and Zhong more recently in 2021. And what we found was that conducting this, having done this baseline activity, we were able to identify that over 16 years, and this is the 16 years in that context, we can identify really through descriptive analysis really how topics and tags between the two online social media platforms sought to understand where there are healthcare educational inefficiencies and identify what educational needs still need to be met in the care for both pediatrics or young people and adults going through chronic kidney disease. So in addition, this baseline quantitative data was implemented to really understand online patient educational requirements and a Qualtrics survey was implemented to collect some additional data from a quantitative basis, and a Qualtrics link was used to invite participants to provide their responses really to questions between to answer to provide responses so that they can so that the research team could actually understand where future education and educational needs and requirements could be met, and this was work and the quantitative data set in full can be identified through one of the presentation slide sets on the RPSG YouTube educational channel, but also there is a poster audio summarizing that work from a quantitative perspective on the RPSG audio channel as well. So listeners are welcome to visit that, a summary of that presentation, which highlights a summary of that data. The research protocol ID for this investigation was sought by the Northwest Greater Manchester South Research Ethics Committee, and that came with its own project ID, and patient and public involvement really and truly has been pinnacle and an important mechanism really to involving both patients and professionals really to add focus and rigor, and tables 1 and 2 in this poster presentation provide a summary of topics developed for those on the RPSG, and those on KDARs, these topics relate to themes or educational themes, and I will read some of that context because I think it's useful for listeners to get a feel for some of that data, but I won't read all the information within these two tables. I will this work hopefully just from this audio it will give a feel for the kind of perspectives coming from individuals, at least from two different renowned social media platforms. So a bit about the results and the analysis in this work. So five main themes were identified through this investigation, including number one, using different mediums to collect qualitative data and understanding healthcare. Number two, reliability and validity of using the internet to collect data. Number three, healthcare patient and public involvement and maintaining confidentiality through online methods to collect qualitative data. Number four, advantages, disadvantages and limitations to online data collection and peer support groups. And number five, using qualitative methodology to understand educational needs for CKD patients. So in addition, this study informs the social media groups between adult and pediatric cohorts and discussions on not just clinically relevant, but also form pinnacle understanding of where the educational gaps have been for patients, at least to online cohorts, adult and pediatrics, and where gaps in education have been for close to 2 decades. When conducting this work, it was 16 years, but overall that's quite close to 2 decades. The RPSG has close to 9,000 members globally, sorry, and KDARS has just over 1,700 pediatrics and young patients. So the KDARS support patients between from any age from 0 to 17, and potentially 18 as well, and the RPSG supports those who are 18 plus, and so between the two international groups, and as part of the quantitative or initial topic tagging activity, 2,560 threads were tagged against 14 topics, and the results here or in the full paper more so, reports that patients between both adult and pediatric cohorts again still require that additional support, educational support, as part of their condition trajectory across several areas of kidney care, and the retrospective trend analysis really provides a snapshot of the qualitative context around the topics, and context in relating to the evidence based from the two online cohorts for over the 16-year duration. Now, just to give you a flavor really of what's in the a flavor of what's of the topics tagged, or the themes, the year the patient the year the patient posted, the patient context, and the context, and how that context relates to the evidence base. So in the adult renal population, there was in the adult renal population, and from the RPSG perspective, there was context going back as far as 2011. 2011 was one of the yes, it was 2011 when context was put forward in relating to one of these educational topics or themes, and that's related to lab tests and biomarkers. Now, just to backtrack a bit as well, the 14 topic tags were thus, and these were the same topic tags used between both social media platforms. There was so these are the ones, and I'll read these out so listeners can get an understanding of what patients online would find advantageous to relay their context around when trying to identify educational context to support areas of their healthcare. So lab tests and biomarkers was 1, biopsy and surgery was 2, diet and nutrition was 3, renal replacement therapy or RRT was 4, psychology and related was psychology and related was 5, medication and pharmacy was 6, lifestyle was 7, primary care or GP was 8, wellness and well-being was 9, nursing was 10, exercise was 11, peer support was 12, COVID-19 and infections was 13, and electronic patient records or EPRs was 14. Altogether, when adding all the context up between these 14, there is actually a 15, but the 15th is not reported. There is there is from the research on the quantitative perspective of that also surrounds this work, that in the full data set there is context in there that relates to the educational the 15th a 15th topic tag which focuses on education and interactive. But when you add all of this from a qualitative perspective, those 14 themes or educational topic tags, when added all together, a 15th does comes out automatically, and that is the educational and interactive theme as well. But the context on its that theme or topic on its own, the KDOS actually did not have as much context around the educational element, and that should be understood. Whereas the RPSG, because of the duration that it has been continuing to be available for patients, the educational and interactive context and theme has its own identifier as well. So those are the main topics. Now, in line with this, the one context I want to read out, just to give a flavor really of how things join up. Topics tagged and the themes under lab tests and biomarkers. One patient back retrospectively in 2011 had written as part of a thread that was tagged around this particular theme. One patient put, my husband today's blood report reads a creatinine of 8, urea 113 or 113. Last report was creatinine at 7, and before that was 4. He undergoes dialysis weekly twice. I do not understand why the creatinine and urea level is still at peak, or this is or is this normal for dialysis patients? So that's the patient context from dating from 2011, and there was context that goes back from 2000 and early as 2010 and late 2009 and 2010. But this was the context that stood out the most under this particular theme. And so where this relates is relatable, or where it's relatable from an evidence-based perspective, or where a source of a further source of understanding around answering the patient's question. Really, there's work published by a team where the lead author is Nisha and colleagues in 2000 and sorry Nisha and team in 2017, where they write context around where they have a paper published on biochemical evaluation of creatinine and urea in patients with renal failure undergoing hemodialysis, and that was published work in the Journal of Clinical Pathology and Laboratory Medicine. Now, albeit the way that the context is written by the patient, for health professionals that might not be deemed as clinically relevant context, because the way that health professionals use language and literacy versus how patients use language and literacy, there is going to be there would be off the bat there would be a disparity. What should be understood here is that between both of these social media platforms, really and truly, patients are using a clinically relevant context. They would communicate their understanding in one way, and in one way, and the way they provide that context should be relatable to the very professionals who offer the clinical care and medical care. To put another perspective, I also want to read something from some qualitative data from one of the themes in the pediatric renal equivalent, and through CADARS, and I'll read this from biopsy and surgery, and the earliest context around one of these themes in CADARS was in 2016, and that was around wellness and well-being. But I do want to read one. I want to read the context around biopsy and surgery, because this is the area where patients and families really find it most anxious from pediatrics, from a pediatric perspective, and that is to say that so this was posted in 2018. And again, there's no patient identifiable information in any of this work, and we made sure that we were following the procedures around the ethics, as well as the General Data Protection Regulation 2018, so that context would remain anonymous. So the context around renal biopsy from the pediatrics equivalent was that so we're 4 weeks post transplant on our fourth admission. The creatinine is sneaking up again, and they are not and they're not saying why. Second, not yeah, I'm not sorry, not sure why. And second biopsy tomorrow to see if this uh, uh, sheds any information. Um, um, Now that context is where evidence base is concerned. Around that, there is a paper by Burke and in 2000 and excuse me, uh, in sorry in Burke in 2012, where the author talks about surveillance biopsies in children post kidney transplant, and that was published in Pediatric Nephrology in 2012. I do want to mention something around the wellness and well-being. This is context that's been posted on KDARS, and this was identified retrospectively from 2016, and the context, the patient context is patient was born with a form of abbreviated with a form of reflux. Actually, the patients they have put PUV, which is a form of reflux. The abbreviation is actually PUV is actually it is actually would be deemed as clinically relevant context in relating to patient record or coding, and so what they wrote is exactly what a clinical a clinician would have found relatable. So they said patient was born with PUV. This week has been an extremely hard week for him. So this is a parent or a guardian talking on, but putting their context in relating to their son or daughter. So this week has been an extremely hard week for him, but he is getting stronger with every hour. Anyone else experience both HD and PD? Did you notice any difference in sickness between the two methods and general wellness? A paper by Clave Clave in 2000, Clave and team, sorry, in 2019 highlight quality of life in adolescents with CKD who initiate hemodialysis treatment, and that was published in BMC Nephrology online. And so what we're saying, or what we've identified, is that in response to work by Van Dam, and this must be understood as well, depending on what social media platforms, for example, or online groups, even researchers go to look to recruit and understand gaps in health, that has to be questioned as well, because if they are using those bases, those groups wherein people talk and relate with of course the best of intentions, but there is still an obvious language barrier, then obviously when it comes to reporting any data, whether qualitative or quantitative, then it can be skewed so that or look it can come across in a biased manner, so that the research may look more may look more pronounced as to where gaps need to be bridged in more ways than one, and how certain areas of healthcare could be more where investment in those areas could be more advantageous versus more broadly. So I'm now going to just highlight some context around the conclusions. Retrospectively, methodologies for data collection have become more diverse, and the way patients are encouraged to get involved in research is also becoming of wider intrigue, and that's being highlighted by several authors. Murray and Fisher highlighted that in 2002, Pope and Mays in 1995, Rhodes and team in 2003, and there's a team in two different teams in 2007, Steele and team in 2007, and Van and team in 2007 as well. To facilitate patient engagement or interaction, this step should be accompanied by strategies to support patients interpret and ascertain education provision around disease trajectory. That should be every healthcare professional's priority, and this would strengthen patient professional efforts throughout, and that's something to be understood. And there's authors who highlight that work again, sort of more retrospectively in 2007, by Stephen and team in 2000, Stevenson and team in 2007, and Manan and team in 2006. Now, patients between the two social media platforms have educational needs, and thus access to broader healthcare professionals online, or wider healthcare professionals or AHPs online or otherwise, would be important to support best practice in future. So what we find is that, for example, in future we might find that increasingly AHPs find themselves taking on more roles, particularly where involvement is increasingly dependent, bridging educational gaps and alleviating misinformation through online spaces. And that's what really and truly what between the two social media platforms, that's what's that's been that's been one of the forefront aims between the two groups, and obviously making sure that that is linked with understanding of where evidence base is also highlights where there there has been issues around literacy and language in and around healthcare more generally. So kidney care nomenclature is also continuously developing, and that's been highlighted by Alam and colleagues in and team in 2013, and the Doki guidelines also highlight that the nomenclature has been developing, and certain terminology, for example, renal replacement therapy has been used for the best part of 3 decades or over 30 years, but more recently that's now being updated, for example, to be so RRT to be replaced with KRT, or kidney replacement therapy, and really and truly, RRT, for example, can be used synonymously, or should be able to be used synonymously with KRT, but it does also beg the question, is that going to benefit the patients more, or will it benefit the professionals more? Is it a case of where professionals themselves feel more comfortable with it because of aspects of their own medical training, for example. Now, in line with this as well, that it must be appreciated that patients should be armed with the appropriate context and information or education, so that they are able to have engaging communication and discussions with health professionals and service providers. To this end, it is now time that patients have access to different professionals to help bridge those areas surrounding educational advice and support, and that's really been highlighted by work by Mohammed and colleagues in 2020, in a paper that was published in the Turkish Journal of Nephrology, but also to an extent has also been highlighted prior by Van Dam and team in 2017 when exploring areas that prompted this work to come through fruition. Topic tagging for 1 month per social media platform, although it was an extensive activity, and more could have been done, more time could have identified more than the number of topic tags, topics that were number of threads, that were identified under the different themes. But the research team was weary, was weary of the fact that the two social media platforms had to make sure or ensure that the work that was being done was time focused, and so however, more thread identifying or topic tagging could have offered opportunity to identify more experiences between the two social media platforms and help conduct a more in-depth analysis. Patients and families will also require educational support surrounding CKD guidance, and access to AHPs can provide patients with that support around evidence-based, especially if from a professional development or continuously professional development stance that they actually keep on top of areas in their practice, so that actually the understanding they do provide patients is actually there's a level playing field on both sides. Co-developing educational modules involving patients and professionals would prompt quality joined up care in meeting information needs or educational needs and addressing potential healthcare disparities. Online educational support can offer, in that context, online educational support can offer collaborations between both patients and professionals, and if that is achieved, or if that can be achieved, then there is going to be more joined up thinking between both groups or cohorts, and that way not only do areas of disparity become less of a problem, but there will be more equality and more equity of areas of health through where patients and professionals are more motivated to get the best out of the areas of health, where health and healthcare, where at present there has been problems. I now want to finish there and draw this audio to a close. I want to thank the American Society of Nephrology for allowing me opportunity to provide this perspective, and I do hope that listeners have time to check out the other work that the Renal Patient Support Group and the RPSG have been doing, and do feel free to look at the quantitative perspective that links to this work as well. I do hope that you've enjoyed listening. The full paper, and the presentations that are done on the RPSG are also available on the on ResearchGate, and those papers or the posters are downloadable for free. Just to as a supplementary note, more than anything, on the RPSG website there is there's an education portal. That portal has various papers under different themes, so that is also somewhere that those who are listening to this audio are more than welcome to identify more literature, papers that have been published by other authors around these different themes. So, for example, there's themes around CKD and social sciences, CKD classifications, technology and electronic patient records, CKD frameworks and guidelines, CKD and laboratory practice, CKD and physical activity, CKD and transplantation, CKD and immunosuppression therapy, CKD health literacy. There's some papers around experimental physiology, some papers there around deprescribing, and some papers around campaigning and initiatives. So if you click onto any one of these particular themes, you can identify several papers that are in and around this particular theme, that particular theme, and so where evidence-based is concerned, and bridging those areas around literacy and language and terminology, etc. The RPSG is and has from the outset has been a place where awareness and research meet, and the KDARS is or Kidney Disease and the Renal Support Group for Kids, or KDARS. That is an online space pushing for pediatrics. So I want to say thank you again for listening, and do feel free to follow up any of these works with the Renal Patient Support Group team. Thank you.